Okay, so in this session, we're going to be talking about breath. And number one, talking about breath. Why is this so important? How to breathe, not that you don't know how to breathe, but how to breathe more effectively in a way that's better for health, physiology, psychology, etc. And a few postures to practice and try to see how that helps with your breathing. Okay, so first, what is breath? What is breathing? So unconsciously, I would say most people, when they see or hear the word breath, it has to do with this need to be alive. There is this, you need to breathe, right, to stay alive. And then because of our education and our culture, then we think about the more, lack of a better term, the more reductionist anatomic physiologic parts of breathing. So that involves there's stuff in the air that's moved into the lungs, and then there's oxygen, exchange of oxygen, carbon dioxide, and these gases. But that is true. And if you go even further, we talk about respiration, right? The phases of inhalation, inspiration coming in, and then the exchange of the air inside, and then the exhalation, expiration air going out. If you go into more detail, we can follow those oxygen particles, molecules, as it goes into the smaller spaces, goes to the lungs, then what we call the cellular respiration, in which the oxygen and the cells and mitochondria are using it to make energy, and then the waste products are involved or make carbon dioxide, and that's breathed out. So that's the super short version of what we, in a physiologic, metabolic way, when we talk about breathing. And like I said before, this comes after the sense of just need to breathe to be alive. Another dimension of breath is the psychological / metaphorical aspects. So even today, we have a lot of idioms and phrases and many languages that involves breath or has to do with breath. So take a breath of fresh air, has to do with a refreshment, a renewal, something being different, right? Breathing down someone's neck, right? It has to do with this. Sometimes when you're explaining things that you just connect and say, but if I had to explain what does it mean to be breathing down someone's neck, is you can feel the breath on your neck, or the person you're breathing on is feeling your breath, and it has to do with invading or oppressing or suppressing this area of the neck, or the behind you, as if you're just being smothered. And even the word inspiration, most of the time we don't use the word inspiration to mean, oh, I'm breathing in. We use that word to mean I got a new idea or a new feeling or something. And opposite of inspiration, expiration, we don't use to mean breathing out. We use it more to say something is finished, is over. The can of whatever has expired. The due date is past the due date. So there's, again, number one, the more physiologic bodily aspects of the breathing. There's the psychological, metaphorical aspects. And then there's also the spiritual aspects of breathing. And by spiritual, I don't mean metaphysical or religious, although I would say there is some correlation there based on human history and our psychology. But even if you look at the word spirit, spiritus, and the etymology of it, it has this correlation and component of it that has to do with just breath. Breath, spirit. Spirit means breath, breath means spirit. And not just in the English, the word spirit, but also the word qi, right? And in Chinese thoughts, philosophy, medicine, qi is often interpreted, translated as breath, but it's a lot more. Same way the spirit can be interpreted as breath, but it's a lot more. Same things with words like prana and pneuma. And by spirit here, I mean more of this, the movement, momentum aspect of the breath. There is this, what I was saying before, the inspiration, expiration. There's this movement, momentum, and the energy that comes with anything that has motion. So when we breathe, then all of this is happening. There's a physiological inspiration, inhalation, exchange, exhalation. It's also psychological, metaphorical, and spiritual. Okay, so now that we're finished talking about what is breath, and can easily transition into why is breath important. Without breathing, it's can't really live. Not just in the physiologic sense, extrapolating from what I said before, but also in the psychological sense, but also in the spiritual sense. Without breath, those aspects aren't coming alive. So we want to have breath not just in the body, but also the psychological, spiritual, relational, communal, energetic, all the different aspects of who we are, because that is health. And now that we talked about what is breath, why it's so important, let's talk about how we breathe. And we're not going to do a very detailed anatomical physiologic lesson, but it has more to do with our body in terms of how I would say a lot of people do breathing, but how we should be breathing. So our main breathing muscle is the thoracoabdominal diaphragm. So basically the diaphragm, the muscle that separates or partitions in a way the thorax, meaning the thorax above here, and the abdomen, meaning below here. So thoracoabdominal diaphragm. It's this umbrella, dome-shaped muscle and connective tissue. From the front, it has connections, attachments to the xiphoid, bottom of the sternum, along the bottom of the ribs, follows the ribs in the back, as go all the way to rib 12, which is actually, if you follow this now, this is much lower than the front attachment here, as well as the top of the lumbar spine. And what happens when we breathe, when that muscle contracts, what it does is it's in a dome shape. So imagine this is the diaphragm here. The thoracoabdominal diaphragm. The reason I say that is because we have multiple diaphragms, and not that it's confusing, but I think I just want to be complete here. So the thoracoabdominal diaphragm, when it contracts, it's better if I show it this way. It contracts, and then this causes a pressure difference, and then the air that comes in is able to be brought into the rib cage, into the lungs, etc. But so it's basically pulling in air, and when the diaphragm relaxes, the pressure changes, so the air wants to come back out. So the thing is, though, because of our sitting posture culture and a lot of things we do, a lot of us breathe with our chest, primarily with our chest and rib cage. Now, breathing is a whole body, whole person experience, right? It's not just the rib cage or the diaphragm, but really the thoracoabdominal diaphragm should be the bulk of the mechanical part of the breathing. Now, if we need extra breath, let's say we just had our heart, we're exercising, something excited us, then we're going to breathe faster and we need more oxygen. So other muscles, ribs, and body parts come in so you can breathe faster and deeper. But at a resting, relaxed situation, we really should be primarily breathing. And we should always be primarily breathing, but the most active muscle should be our thoraco-abdominal diaphragm. Not so when you take a deep breath in, you shouldn't be really doing this. No, I hyper exaggerated. Deep breaths in should be primarily be felt and happening in the belly. So this is a, let me show you what I mean here. You can also follow along with this. Put your hands, it's my belly button here. Put your hands below your belly button. Now, I'll put one hand here so you can see. So we have the diaphragm like this. So when I take a breath in, this contracts down. The belly then should expand because everything here is being, I don't say pushed down, but displaced so that the pressure difference can bring air in. So this is what I mean. So I'm gonna put my hands under my belly button either side. So this is belly breathing. Let me do this so you can see me. Deep breath in, as you can see, if you look very closely, my hands are coming out and down with breath in. And as I breathe out, they come back and up. So let me come closer here. So breath in, breath out. In, out. As opposed to breathing with my chest. Idea is that primarily a breath should be coming and moving in our belly. This does a lot of things, which we won't go into too much in this session, but the idea is to get the idea down that we should be breathing with our belly. This is what we're going to call belly breathing. Now, if you're not sure how that feels, this is the best way to, if you're able to feel what it feels like. So lie down on your chest and your belly. So now sometimes in the patients that are ventilated in the intensive care unit, this is what they do. They turn them on their chest and it helps aerate better and helps with the air exchange. So what happens is that because, let me pretend here, if your chest is not able to move up and down much while breathing, then it really encourages the thoraco-abdominal diaphragm breathing to take over. So I will try it with me if you'd like. Lie down on your chest. You can use the pillow, but then it may bring your chest away from the table. So for now, I'm just going to do it like this. Doesn't matter the head position. And I mean, it's not much you can see, but I will, I'll put my hand here and here, meaning on my back, just to see if you can see my motion of my hand as I take a deep breath in and out. Deep breath in and out. So on in, as if the balloon is blowing up, or bigger, expanding. And as I breathe out, the balloon contracts, gets smaller. So prove that when your chest is not able to, you really get a sense of that belly. And if you like, you can just stay like this for as long as you need, just to really get your belly breathing going. Okay. The next way to get a sense of what it feels like with the belly breathing is to, if you can, and it's comfortable for you, squatting down You can hold on to something if you'd like. And take deep breaths in and out. And with this, you also feel the belly and the pelvis moving a lot more with the breathing. You'll feel things move, open up and move downwards with your breath in. And contract, collapse a bit as you breathe out. Okay, so you can keep doing that if you'd like to get a sense of the belly breathing. Now, eventually the idea is to be able to make the belly breathing into your normal, natural breathing. So you're walking, talking, doing anything, sleeping, that is your basic normal breathing. One more thing to talk about, why is it that doing breath, whether it's meditation or exercise or just for general health, why it's so important, is the vagus nerve. It is one of the cranial nerves, and depending how you look at it, it comes from the brain or to the brain. And it's called the vagus nerve because it travels, the same root as vagabond, it travels quite far through a lot of the body and into the belly area. But most importantly for here, it's important to know it goes through, it pierces the diaphragm, you could say, or the diaphragm is around it. And every time you contract and expand the thoracoabdominal diaphragm, it's engaging with the vagus nerve, and you can consider it activating, assessing, or working with to encourage the vagal tone. And why is that important? The vagus nerve is the big component of the rest, digest, relaxation, calming down part of our nervous system, the parasympathetic nervous system, which is outside of our conscious control, which is the partner or flip side of the sympathetic nervous system, which is to get up and go and active and stay alert. And most of the way our culture is, we're just overly sympathetic, overly active, overly vigilant, overly, yeah. And by doing this belly breathing and activating, assessing, and working with the vagus nerve, we're able to get a better equilibrium between the two so that we can be healthier. And there are plenty of modern research showing how working with the vagus nerves helps with heart rate variability and helps improving various other chronic conditions as well. But this isn't something people knew the way we know for centuries and millennia. They just knew that working with the breath is helpful physiologically, psychologically, spiritually. Okay, so for the next part, I'd like to very briefly show a standing, how you can do this standing. No, first actually, let's do this seated. So actually standing first and then seated, and there's a specific reason why. Okay. So with standing, what you're going to do, let me move this camera just a little bit so you can see a little bit better. So my feet are in line with my hips, and I'm going to bend my knees a bit, but my hips should be right over my feet. So it'll look like this, meaning not like this or this. This point, if I follow it straight down, not through my knee, straight down, it should be over my foot. So I should need to go like a little bit more like this. You can think of it as this part of the foot is under this. Okay. And if this bothers your knees and whatnot, then do something that's more comfortable, but I'm just demonstrating the way to do the standing. And you can also just go down a little bit until you feel your gluteus muscles engage and take deep breaths in and out. In other words, this is kind of like a starting a squat, but not quite squatting. And as you breathe in, you can feel the breath and the belly coming out. Well, breath coming in and belly going out. And the breath out, the belly recedes and the air comes out. And if you want, you can also feel how that's titillating the vagus nerve, how that's getting the parasympathetics to be more online, and how that's going to help calm things down. Now for the seated version, not to say you have to be seated like this all the time, but this is I think the best way to explain. Now, imagine I was standing like this doing my standing breathing, and I'm sitting down. But importantly, your genitals, your front of your groin needs to be off of the chair. Number two, I'm gonna raise this a little bit. Your level of your knees needs to be below the level of the hips. Your knees need to be fairly open, so not 90 degrees, and especially not less than this. And if you followed your hip forwards, they should be in line with the foot. Okay. And I'm just going to put my hand below the belly button just because I think that's the easiest way to feel this. Again, making sure your front of your pelvis groin area isn't hitting the chair. And bringing your feet out more if you need to open up your knees a little bit. And then there we go. Breathe in and out. And this is a separate discussion, but you can notice how this positioning also helps with your posture and your whole body. Okay. So to recap, this session is to introduce breath as why it's so important to health. Yes, obviously you need breath to stay alive physically, but it's also, as we talked about before, there are psychological and spiritual aspects of breath. And spiritual in the sense of movement, of literally it's useful word breath. And to emphasize the use of the thoracoabdominal diaphragm to be the primary mover of the air. And we use our hands under the belly just to monitor that. And we can get a sense of that lying down on our chest, squatting, or getting into the position where you're standing with starting a squat, or sitting in the chair in the position we just talked about. So what I'd recommend, what we're not going to do in this video, is pick any of the positions or practice doing all the positions and simply breathe. And I've been talking a lot and giving a lot of information, which kind of made things a bit heady. But now when you're actually doing this, don't think about how things feel, or yes, be in the proper position, but don't think about, oh, this air is coming in here and it's doing this nerve is doing that. There's a time and place for that. But the other important part of this is to just let the body, your psyche, your spirit do what it needs to do with the breath. And finally, I would recommend there are other things we could talk about, which are helpful, but don't want to give too much at once. I would recommend breathing in and out with your nose, keeping your mouth closed, and putting your tongue at the roof of your mouth. See if you can capture this. So not immediately behind, also not all the way back. Just a little bit behind the teeth. And we'll talk about why is that later. Now, if you're doing this breathing while driving or sitting somewhere else with a chair, you can't do that. Or you have cold or allergies, then breathe it with your mouth, that's fine. But get into the experience of breathing with the nose. And later we'll go deeper into that aspect as well. But this is the introduction to the breath, why it's important, what it is, how to work with it, and how to benefit the most with working with it. Okay, so breathe on.